Made possible through support from ARC Thrift Stores, Colorado Access, Colorado Developmental Disabilities Council, Developmental Pathways, and the ARC of Aurora. Think Change Talks. Foster care is a temporary arrangement that gives youth a safe place to live when their parents or family of origin are unable to safely care for them. The ultimate goal is to safely reunite a child with their family. Developmental Disabilities and Foster Care, a series of different perspectives.
I'm Jayla Nierhoff, and I am a recruitment retention caseworker for the Collaborative Foster Care Program. And we recruit, retain foster families and certify them for the counties of Arapahoe, Douglas, and Jefferson County.
My name is Haley Wolf. I'm also a recruitment and retention worker for the Collaborative Foster Care Program. Actually just transitioned to this role from certification work, where I supervised and coached about 20 of our foster families as they had children in and out of their homes. Our role at the CFCP as recruitment and retention workers is both to recruit new homes so that we can meet that need and better match children with families who can meet their needs and make them feel safe and comfortable, and also to focus on retention. So the families that we do have, acknowledging how difficult that can be sometimes, and providing the internal supports and external resources so that they can continue to serve children in their homes.
While there are kids with developmental disability diagnoses in foster care, not every child has that diagnosis. However, when you become trauma informed and you learn the impact of trauma to a child, you learn that developmentally and emotionally their brain does stop developing. It's not uncommon to experience a grown child with the mindset developmentally and emotionally of at a younger age. And we've even learned through trauma training that if a child experiences trauma in utero before they were born, such as drug use, exposure, or domestic violence, that brain development stops in utero as well. And so that can have long-term effects on the child's development all the way until they're an adult, where it just takes them a little bit longer to process things emotionally or understand developmentally or stay on track.
I think what we're really talking about is healing communities. So having the education to understand the impacts of trauma and generational trauma and poverty and mental health on all of these families so that they can have the wraparound supports where they don't need foster care. And then when that's not possible, having a community that steps up and says, that's our kid, and we're gonna step in for that kid so they don't have to change schools, they don't have to move away from their friends. I think that's kind of the core of it, is what needs to be put in place for communities so that families aren't separated, and that when they are, kids aren't moved out of everything that they've known.
Fostering it's a hard ask for families. It's not something simple that you just decide to do. It's a life-changing event, and it not only impacts that person but their entire family, their neighborhood, their external family. And when someone steps into that, it's often, we're often told that it's a lonely role because the common person doesn't understand how much that can impact your world and your family. All caseworkers are trained, as well as that we really try to train our foster parents as well, is to tell the kids, you just need to find a place for you to stay temporarily until your parents can have a safe home for you to go back to. And really trying to word it in a respectful manner where we're always talking positively about the biological or the biological family or the family of origin, both from the caseworkers, all the caseworkers, as well as from the foster family that's talking to the kids, so that it's the same consistent message and it's all delivered in a very respectable manner. You'll find that when a family of origin feels supported by the foster parent and they are receiving the message that that foster parent wants my child to come home to me, not they're trying to steal my child from me, when they feel supported from them, they work harder and do really well in their treatment plan, and we have a higher reunification rate when that happens.
On our side, what we're telling kids is that you're safe, your feelings are valid, we see you, and we want to partner with your family so that you can go home.
To learn more about convenient and contemporary educational products through ThinkChange, visit www.thinkchange.training.